Hello everyone, my name is Dr. Dave. I'm a licensed podiatrist. I'd like to thank you for watching my video on my Frugal Foot YouTube channel. I like pulling out my Stedman's Medical Dictionary from time to time and looking up different words that we use in podiatry. And I have a word for you today. It's called metatarsalgia. Now, maybe you have been diagnosed with metatarsalgia. Let's see the definition in Stedman's Medical Dictionary. It says, pain in the forefoot in the region of the heads of the metatarsals. So let's look at our foot model here. There are 5 toes and there are 5 metatarsals, and those are the heads of the 5 metatarsals. And so if you have pain in the region of the heads of the metatarsals, then one could say that you have metatarsalgia. Okay, so what? See, here's the problem. That's not a very specific diagnosis. And if a doctor gave me that diagnosis, that is not something that I could easily accept. I want to get that doctor to give me a more specific diagnosis because, well, here are some of the different things that can occur around the heads of the metatarsals. You could have a Morton's neuroma. You could have an irritation of the capsule of the joint. You could have a stress fracture. You could have deadening of the bone, avascular necrosis. You could have a sprain of one of the ligaments. You could have tendonitis. There are a lot of different problems that can occur in that area. And so just simply saying metatarsalgia, okay, so you have pain in the metatarsal head region. I think you knew that going to the doctor's office to begin with. Why is this important? Because when we get to the treatment, we really need to know what the actual problem is. I mean, look at it. If you went to the doctor and the doctor said, you have metatarsalgia, we need to do surgery. Well, the question then is on what? What are we doing surgery on, right? We're just not going to open up the foot and look. So metatarsalgia is what I call a wastebasket medical term. And it's not one that I use in my practice. There's actually a diagnosis code for it, and I don't even know what it is because I don't like doing that. I would prefer to create a list. We call it a list of differentials, a list of different diagnoses that encompasses what I'm thinking could be the problem, instead of just using a lump term, metatarsalgia. So that's at least my thought on these wastebasket terms and that term metatarsalgia that we just learned about in Stedman's Medical Dictionary. I don't accept those terms. I don't use them in my office. I try to be much more specific. I think it's better for me. It's better for the note because when I look back on it, when the patient comes back, I want to be able to refresh my memory a little bit better on what's going on. I think it's better for the patient because you can explain it to the patient better and they will understand the treatment plan better and probably be a lot more, they'll follow up, they'll do what they're instructed to do. They'll be a lot more compliant. That's the word I'm looking for. If you agree with this, give the video a thumbs up. I'm Dr. Dave, and I'll see you on my next video.